Hi. Hi, this is Dr. Kim. I'm from CNS Rehab. Today I wanted to introduce you guys for one of the part of the Oriental medicines, which is cupping with the needles. I have one patient here since a month and a half ago who has a surgery done by last year June from C2 to T1. He has a fusion and then about 14 screws on his neck. And definitely he's suffering. The surgery was done by well, but suffering with a lot of stiffness and pain and spasm. Even he has complained a lot of headache since I met him. I've been applying for 5 times about the cupping techniques. So I wanted to show you details, okay? This is we have the things. This is the cups, okay? And then this is a small the needles. We open up this top. There's a small tiny needles there. So we're gonna apply this needle to the skins on his neck, and then with these cups, and this is a suction gun. So we have to suck this air from the cups, and blood is gonna come out. And then after this, what's gonna happen then? Patient, first time and second time, third time, he relieves a lot of stiffness, and then also he's been have a lot of good results. Stiffness, headache, and inflammation also too. So I wanted to show you again. This is 6 times we're doing it now. Okay, this is my patient, okay? He hasn't been here, surgery from C2 to T1. Okay, I'm going to apply 4 cups, which is from cervical area, upper part, C2, about C4, and the lower part, C7, to T1 areas. I'm going to apply 2 here and tab over here. So let me start first this cleaned with the alcohol swabs, which is applying area, and then we have to use this cup first, the bottom line. I'm going to apply this needle, which is retargeting where the patient mainly complain, and also which there have a lot of inflammation and stiffness. Okay, I'm going to apply this spot there. This is a needle. He might have some pain, but it's not really hurt. Okay, then a little bit more. Okay, you see the little blood. Okay, now, are you okay?
Yes.
Okay, so this is gun, I use it. We're sucking up the blood. And then second cups apply. I'm going to this part here again, okay? Which is, like I just told you, have a lot of stiffness and blood stasis, and then pain and inflammation here. Okay? A little bit this. And then apply the cups and use the suction gun again, and then suck the blood. Are you okay, sir?
Yes.
Any dizziness?
No.
No problem, right?
No problem.
Okay. As you see that, the blood comes out in about maybe 1 to 2 minutes. You will see how the blood, how much comes out. The first time, he has a lot of blood. With the color even is not really the red. It was very dark black red. But now, every single visit he comes, every week, and then once a week, once to 2 times, either 1 to 3 times. Okay, every visit depends his condition. We could apply that. Depends everything on his conditions. So this is 6 times we're applying it. First, the bottom 2 parts. Okay, the blood's coming out more now. Is it okay, sir?
Yes.
So now I'm going to apply top, which is the cervical area. This one and the other one too. Okay, we have to first clean the area, which is we're applying the cups, and then you will see how it's gonna work. Okay, we're poking the skin, then we apply the area exactly, then I'm going to suck again. The bottom part has still, we have a lot of blood there. Okay. The other one, we're going to this drawing. Okay. Take a look. All right. Sometimes I apply 2 cups. Sometimes apply 6, even 8 cups. Depends where it hurts and what kind of problem they have. So some of them have very good result, which is right after these procedures. Some of them still takes a little bit more time to see the result. First, like the pain, stiffness, depends, like I told you. But this patient who has done by surgery, which is a fusion, which is last year, he's been got physical therapy for a long time, but he didn't really satisfied. He actually is satisfied with them, but the chronic stuff, which is stiffness, pain, and then especially the headache, he can handle with this. And then he came to me, and then now he's really satisfied with my procedures and the treatment. So we are applying 2 kinds. Apply the physical therapy and the oriental medicine, which is acupuncture and those kinds of procedures too. Let's take a look again. It's been about 3 minutes, 2-3 minutes. Look at this. We have a lot of blood here. Some of them has more, some of them has less, which means that this part has more blood stasis, which is like, we have to, blood goes run, very well. But somehow there's some traffic. That's why we have to take the blood out through this and then apply the needles, and we do some other procedures. And then he feels way much better. All right, let me clean this now. So patient, we should keep asking him, how do you feel? Then anything like, the dizziness and a headache. So we have to keep asking and, communicate with him. So how do you feel now?
Good.
Is it okay, right?
It's okay.
Okay, good. So what I'm going to do now, we have to use this for make sure everything is go well. This much blood comes, like a lot. So we use this way, and then take the blood gradually, make open the air, and then blood starting to come out. Look at this, a lot of blood. Okay, so we take out to clean, and then take a look. There's a small spots over there, which is a bruise. After the needles, and then have a circle, make like this kind of shapes, and then it stays like some patient takes like a week, some patient takes like more than a week too, but it goes away. Just temporary, the stays last, few days. You okay now, right?
Yes.
Okay. Okay. We should be very careful. If patient sometimes they move, then top cup is fell, then blood is gonna be moves to all of their bodies, which is not that's not we wanted. Okay, there you go. Take a look. Okay. Wow, this is the most largest amount of the blood that we have. That means I can see a lot of problems here now. Look at that. Well, hold on, don't move, okay? There you go. So to clean this, okay. So we have more alcohol swabs. Okay, clean this clearly. Make sure everything is done by very clean and nice after this. Okay, this is the first we finished the cupping techniques, and then I'm gonna ask you this procedure to my patient. How do you feel now?
I feel good.
Okay, tell me the first time and then after this couple of procedures. Okay, come here then. Let's take the showing him the
I cannot compare. It's more better.
feels much better than before, right?
Yeah.
Okay. So, are you willing to take this procedure more in the future?
Yes.
If I recommend you?
Yes.
Okay, I'm going to do it maybe a couple more sessions, okay?
Okay.
With the physical therapy together.
Okay.
So we're gonna have more better, okay? So we're gonna feel much better than too, okay? Than before that. All right, thank you.
Thank
you for
Dr.
coming
Kim.
today, all right?
Thank you.
Nice to
Thank
see
you
you.
so much.
Okay, this is okay. We just introduced one of the technique, like I told you, and then hopefully I can introduce you another other techniques in the future. Thank you. This is Dr. Kim, CNS Rehab. Bye bye.